taking the history or without going for the laboratory investigations, how can we diagnose a respiratory disease? Okay, just by looking on the patient, just by doing the physical examination of the patient, how can we diagnose a patient having a respiratory disease and what can be a possible respiratory disease? Okay. So what are the clinical findings of respiratory diseases? What are the signs of respiratory diseases? That we are going to see. Okay. And then you have to correlate these findings with your history that you have taken, compare both, and then come to a diagnosis. Okay. But if a patient is mentally retarded, or suppose if a patient is suffering from dementia, or if the patient is suffering from some kind of psychiatric illness like schizophrenia, etc., if the patient is unconscious, where he is unable to tell you the symptoms, if the patient is a child, infant, where he is unable to tell you the symptoms, just by looking on him or her, how can you diagnose? Okay. What are the possible things that you can go for, and then you can diagnose a disease? So that will be our topic of discussion. Okay. So we have many signs of respiratory diseases. Let us start one by one. The first thing that you have to do is you have to see the patient, inspect the patient for various things. We will start with the basics. First of all, you have to see for the shape of the chest wall. Okay. The shape of chest wall can get distorted in various respiratory diseases, or abnormal shape of the chest wall can also result into different respiratory symptoms. Okay. Both are possibilities. Say for example, if a patient is suffering from COPD, his chest wall will be barrel shaped. But if the patient is having kyphosis, scoliosis, or pectus excavatum, that is funnel shaped or pigeon shaped chest, then again it is going to affect the respiratory functions of the patient. Okay. So how to see for it? The first point is examination for the shape of chest wall. So what you have to do is you have to see for the chest wall of the patient. You can see for the vertebral column of the patient. Okay. And you have to see for any excessive curvature on the thoracic vertebral spine, thoracic vertebral column. Okay. If there is excessive curvature is present on the thoracic vertebral column, that is called as kyphosis. Okay. See for any excessive curvature on the thoracic vertebral column. Excessive curvature, kyphosis. Okay. Similarly, any S-shaped deformity of the vertebral column, it is scoliosis. Okay. Both of these deformities of the vertebral column, they are going to affect the respiratory functions. Why? Because these deformities changes the diameter of the thoracic cage. In a normal healthy individual, the transverse diameter of the thoracic cage, it is more than that of the anteroposterior diameter. Okay, the transverse diameter, it is more than that of anteroposterior diameter. But if the patient is having kyphosis, the anteroposterior diameter increases, which affects the respiratory functions, the expansion capacity of the lungs. Okay, so it changes that capacity, that respiratory function. Okay, so C for vertebral column, C for kyphosis and scoliosis. If it is absent, well and good, then you have to go for the examination of the chest. Okay, from the front side, here we have seen the back, now we will be looking at the chest wall. Okay, काम ऊपर करो शर्ट. And you have to see for any abnormality in the sternum. Okay, if there is presence of any depression at this portion, it gives a funnel-like appearance of the chest wall. Okay, depression at the lower border of the sternum, it gives a funnel-like depression, which is called as funnel-shaped chest. So what is going to happen in this is funnel-shaped chest, the anteroposterior diameter will even reduce than what is normal. Okay, again affecting the respiratory functions. this happens in various congenital abnormalities. One of them is dextrocardia. Okay. Similarly, if the sternum gets protruded, okay, if the sternum gets protruded, then the rib cage will also get protruded. Okay, this protrusion of the chest wall will be called as pigeon-shaped chest. Again, it will increase the antero-posterior diameter, affecting the respiratory function. Okay, so you have to see for funnel-shaped depressions or pigeon-shaped protrusions of the chest wall. Okay. The next point is, when you are examining the chest wall, you have to see for any scar marks present on the chest wall. Any scar marks on the chest wall. If the scar mark is present centrally, it is called as thoracotomy scar mark. And the chest wall is opened from this side in order to perform the surgeries on the heart. Okay, so if a patient is undergoing for CABG, coronary artery bypass grafting, or open heart surgeries like valve replacement surgeries, in that we perform thoracotomy. We open the thoracic cage from the center and then we perform the open heart surgery. Okay. The second type of scar mark can be seen laterally. Okay, laterally, which is called as lobectomy scar mark, and that is performed to remove any tumor in the lungs, any lobe of lungs, any tumor or any mass, whatever. If you want to perform any surgery on the lungs, we perform lobectomy surgery and then remove that portion. Okay, so it is present laterally. So on the chest wall we get two different types of scar marks. The first one is thoracotomy, which is at the center, and the second one is laterally, which is called as lobectomy scar mark. Right? So when you are looking at the chest wall for the scar marks, you also have to see for any enlargement or any swellings, especially at the supraclavicular region. You have to see for any swellings in the axillary region, and you have to see for any swelling in the cervical region. Okay, this portion, which is called as submandibular region, supraclavicular region, and axillary region. Why you are going to examine this portion? In order to rule out the lymph node enlargements. Okay. If you get